Hi, my name is Hannah Mercrelis. I'm a student physical therapist assistant at Jeff State, and today I'm going to be talking to you about Pseudomonas aeruginosa. So this is a pathogen that's very versatile. It relies on complex signaling pathways to be able to colonize. It creates a variety of proteins that allows it to attach to the host and get past the host's inflammatory response. It's a part of the Pseudomonas genus family and is an opportunistic pathogen. P. aeruginosa is found everywhere, in the soil, in your house. It's also most commonly found in hospitals and nursing homes. It does survive for months on dry surfaces, but thrives on moist and humid surfaces such as hot tubs, ventilators, or catheters. It's transmitted through contact, so if you have broken skin or an infection already, or if you have a patient who is already infected and they cough and you breathe in their air, you will be infected as well. So it's not common in the general population because most of us are healthy individuals, so it's going to affect the high-risk patients, such as patients who have cystic fibrosis, type 2 diabetes, immunodeficiency patients, as well as IV drug abusers and burn or surgery patients. P. aeruginosa is diagnosed through cultures. It's taken from the patient by blood or their sputum or spinal fluid, and it's taken to the lab where it's grown, and that's where they figure out how to treat it through antibiotics and which antibiotic will be most effective. Symptoms vary, so it depends on the host or the patient that's affected and the state that they're in, as well as where it's located. But more commonly, you're going to have your fevers, elevated respiratory and heart rate, increased white blood cell count, as well as delirium, dyspnea, and if the infection spreads to the blood, then it becomes septic, or the patient becomes septic. So there are a couple of different types of infections for Pseudomonas aeruginosa. You have your respiratory tract infection, your central nervous system infections, as well as skin, soft tissue, and bone and joint infections. Common infections include hot tub folliculitis, and that is just the inflammation of the hair follicles that have gotten infected from being in the hot tub that wasn't clean, as well as a portion of the gangrenosum. These is your most commonly known type because it is your bluish green color and it gives off a foul, fruity odor. You can also have a urinary tract infection, and those are the patients that often use catheters that aren't cleaned very well, as well as conjunctivitis of the eye from using contact lenses. You can also have osteomyelitis, and that's the infection of the bones, and this is a very good picture depicting the difference of that, a person who is normal and a person who has osteomyelitis. You can also have swimmer's ear, and so those are your patients who don't clean their ear out after swimming for a while, and so that moist area develops and the infection grows. You can also have tricuspid valve endocarditis. That is for your patients who have been your IV drug abusers and users, as well as your more common pneumonia for respiratory tract infections, and those are your individuals who have cystic fibrosis. The medical prognosis, this pathogen is the highest mortality rate, and the survival is based on how quickly it is diagnosed and how quickly the antibiotics gets in the system. The medical treatment for this is using two anti-pseudomonal drugs of different classes to help fight the infection. But there's been more research showing that monotherapy could help fight the infection because this pathogen is so multi-drug resistant, and so a common side for doing anti-pseudomonal drugs is using the monotherapy. There is high success rate with local infections by using topical treatments, antibiotics, patients who have been in surgery, pulmonary therapy, and respiratory assistance. So the main thing we want to try to prevent is by using hand washing techniques. We want to make sure as PTAs that we are washing our hands to prevent the spread, as well as protecting the patient, but also educating to the patient that they need to do the same thing as well. They need to clean the environment, make sure their body's clean, and when you leave, make sure you're cleaning all the surfaces that you've touched that has been in contact with them, and any kind of devices you've used as well. So here's my hand washing video. Hi, my name is Hannah Merculis. I'm a student physical therapist assistant here at Just State, and today I'm going to be teaching you proper hand washing techniques to prevent Pseudomonas aeruginosa. So first we want to dispense the towels. Okay. Make sure all watches and rings are off your hands prior. You want to turn the faucet on, make sure it's on warm water. Go ahead and grab your soap generously, and then next we're going to rub our hands together using soap and running water. We're going to make sure we're washing all surfaces of our hands. Make sure it's the back side of our hands, both hands together. We're going to wash the wrists. And then in between those fingers. Good. Good job. And then underneath those fingernails, just the palm of your hand and your fingernails. Good. You'll make sure you want to try to sing the birthday song throughout this so that you're getting rid of all the germs. Next, we're going to rinse everything off. Make sure you're getting all the areas covered that you put soap on. Once your hands are underneath the water. Great. Now we're going to grab the paper towel we've already dispensed for us. Dry our hands off with that. And then we'll use that paper towel to turn off the faucet. And then we'll throw away our towel. Thanks. So based on the NAGI model, you're going to have some impairments, functional limitations, and disabilities associated with this infection. Some common impairments are decreased range of motion, decreased strength, and flexibility. The functional limitations could be decreased ability to perform transfers, bend mobility, gait training, stair training, and such like that. And a common disability that could be associated with this is patients who have amputations due to becoming septic or the infection going into their bones. Some implications for the PTA: you want to make sure you're cleaning everything, washing your hands for the safety of you and your patients. For wound care, you will need to have a strict sterile environment to help clean it and combat any further infections from spreading, and you want to also look at the lab values before each treatment. Some precautions: you want to use your universal precautions before entering the room and treating this patient. And contraindications, of course, if there's any indication of a DVT, we're not going to treat them. So how can physical therapy help? So what we can do is we can address the exercise deficits by strengthening and stretching the affected side or limb, as well as the non-affected side. We want to work on bend mobility and positioning, especially for patients who have been burned. We don't want to put them in positions of comfort to reduce the risk of contractures. We can also work on transfers, wound care, managing their pain. We can also utilize the tilt table to get them used to weight-bearing status for those who are bedridden, and gait training along with education. So this pathology will affect the treatment plan because essentially this pathogen has tricked the immune system and the inflammatory response to think that there's nothing wrong. And so progression of therapy will be prolonged until the diagnosis of Pseudomonas aeruginosa. It's also dependent on the severity of the infection and how quickly the antibiotics work or doesn't work. Some of the limitations they might experience can be weakness and fatigue, so we're going to address that by strengthening and getting them acclimated to weight bearing and gait training and stuff like that. So thank you for watching. Please post in the discussion board if you have any questions or concerns. Thank you so much for watching my video.